Hi everyone, Dr. Joel Schweitzer again. This is video 4 in our series of 5 videos on stress. In the first video we talked about the effects of stress on your body. In the second one we talked about the physiology of stress. Third one we talked about the rhythms that hormones are secreted throughout your day. In this video we're going to talk very specifically about how we diagnose your stress response. We're going to talk about how we take a full medical history, what examination techniques we use. We'll also go into the blood, stool, and saliva test that we use to make a very specific diagnosis for your unique stress response. Now we're going to talk about how we diagnose problems related to stress. As I've said in our previous videos, stress causes many health problems. Therefore, it may be necessary to do several tests to look at the effects of stress on your body. One of the most important points for you to understand is the following. The symptoms you have are not the cause of your problem. Instead, they are the result of the cause of your problem. The above picture of the iceberg is a very good analogy for you to think about. Above the water you see the ice, but below the water lies the real danger. The same situation occurs with your health problem. It is easy to describe the symptoms like fatigue, weight gain, or mood disorders. It is also very easy to prescribe a drug to treat those symptoms. It is more important, however, to find the underlying cause of your symptoms and to treat them. If you fix the underlying cause of your symptoms, you fix the problem, and you make your health better, not more complicated. In our office, we are always looking for the underlying cause of your problem. Now let's talk about the actual examination and diagnostic process. Before we do any laboratory studies, we do a thorough medical history and a detailed physical examination. We also use questionnaires that are specific to the effects of stress on your body. It may be necessary for us to do an orthopedic or neurological exam on you as well. Now let's talk about lab testing. When you are trying to find the underlying cause of your stress problem, you have to order the right lab test and interpret them correctly. Testing must be thorough, but each test has a purpose, that being to give more diagnostic information. I'm not a big believer in running a lot of tests unless that test contributes to finding the underlying cause of your problem. When it comes to stress, many doctors order very few and oftentimes no testing at all. If your testing is inadequate, your diagnosis will be inaccurate, and this will lead to ineffective and sometimes harmful treatment. Nowadays, there are a lot of choices you have to make about your health. If you're not equipped with the truth and enough knowledge about your health, you'll make bad choices. There are plenty of bad choices out there. Why is this important? Because if you don't ask for or demand thorough testing, you will not get it, because the current healthcare system is designed to treat you cheaply and quickly. Here you see some of the lab tests that we use to diagnose how stress is affecting your body. We only do the ones that are necessary, but we are careful not to leave any test out that would be important in the diagnosis. Let's talk briefly about each of these tests. The comprehensive blood chemistry is used to check for anemia and blood sugar problems. They are very important to test for if you're under stress or feeling fatigued. The adrenal stress index is important if you are having fatigue, sleep, or blood sugar problems. We discussed this test more thoroughly in our video titled Stress and the Rhythms of Life. Stress can also cause gut infections, leaky gut syndrome, and food sensitivities. We test for these with specific blood and stool tests. Inflammatory markers like C-reactive protein are important because inflammation and stress go together and can affect the heart and many organ systems. Here is the comprehensive blood chemistry panel. It includes a complete blood count, a thyroid panel, chemistry panel, iron panel, lipid panel, and additional tests. There are some minor variations to this panel where we will add a test or two depending on the presenting problem of the patient. A comprehensive blood chemistry panel is the most effective tool to assess the degree of health or illness in a patient. It is the ultimate tool in biomedical laboratory science to evaluate new patients and to track the health of a patient over a lifetime. It can also be used to investigate the cause of stress. A comprehensive blood chemistry panel provides you, the patient, with peace of mind that your metabolism has been thoroughly screened. You can screen for problems with blood sugar, cholesterol and triglycerides, liver, gallbladder, heart, immune problems, anemia, and much more with a comprehensive blood chemistry panel. Here's the HMO blood chemistry panel. As you can see, the total amount of tests are greatly reduced when compared to the comprehensive blood chemistry panel. Most people get some type of blood test with their annual physical examination. Unfortunately, very few people get the comprehensive blood chemistry panel that you saw on the previous slide. Instead, they get the HMO blood chemistry panel. This presents a lot of problems when you want a thorough diagnosis. For example, you can see that there is only one thyroid test, that being TSH, compared to 4 thyroid tests in the comprehensive blood chemistry panel. The TSH test alone is not sufficient to diagnose many thyroid problems. Pictured in this slide are the results on the adrenal stress index. This is a saliva test which measures cortisol throughout your day. As you can see in the above graph, cortisol is highest at 8 a.m., then it gradually drops down throughout the day until it is at its lowest at midnight. This is a very healthy cortisol rhythm. The adrenal stress index test is very easy to obtain. You simply take home 4 bottles that we give you. You put saliva samples in them at 4 different times during your day. Then you send the 4 bottles off to the lab and we get the report back. This will help us see what your rhythm is, and it will let us know how we can support you in reducing your stress and regulating your rhythm. We reviewed the adrenal stress index more thoroughly in the previous video, Stress and the Rhythms of Life. In summation, when you are under prolonged stress, you need more than the standard advice to get more rest, not worry so much, and eat well. What you need is thorough and specific testing to arrive at an accurate diagnosis. This will lead to effective treatment, and treatment is what we will talk about in the next video. Please watch our other videos on stress. If you watch all of them, you'll get a complete picture of what stress means to your health. You'll also find out how we diagnose stress and what we do to treat stress. It's a good idea to watch the videos in the order listed above. Thank you for watching. If you have any questions or would like to make an appointment, our contact information follows this slide.